Chapter 9, Lecture 2, Antitrust Laws. In the previous lecture, you learned about the role of government when there are external benefits or costs or market failure in the market by any individual agent's decisions. When the individual basically marginal benefit and cost is not equal to the society's marginal benefit and cost. In that case, the role of government is to encourage the positive externalities and discourage the negative externalities by different various types of public sector involvement, such as price ceilings and quality regulations. In this lecture, you will learn about antitrust laws and you will learn about the different government's performance in redistribution function methods, different methods in horizontal and vertical equity, and different types of subsidies. And I finished the lecture by discussing about the impact of Affordable Care Act on government economic rules in the United States health affairs. The main objectives of the antitrust laws in the United States is creating a very efficient competitive market. So basically, this antitrust law's objectives is to promote competition among the firms within an industry and prohibits basically any engagement in certain types of market to decrease the inefficiency. The Sherman Antitrust Act of 1890s prohibits any overcollusions that is basically trying to decrease the efficiency and monopolize the market. So any price fixing, boycotting, market allocations are anti-competitive, they're illegal in the business practices. So for example, price fixings among the business rivals in an industry, which they're buying basically to trying to have a collusive agreement to act as a similar to the monopoly to maximize the joint profit is illegal because they try to lower the output and set the prices higher than perfectly competitive market. So boycotting among the competitors basically is not legal because they're trying to basically not to deal with the specific suppliers or consumers. So this is basically creating barriers in the market. If a specific number of the competitors in the market in healthcare, for example, they don't accept a specific type of health insurance, individually is not a problem. They have this choice, but if they have an agreement among the competitors, for example, not to accept any Blue Cross Blue Shield insurance or Medicare or Medicaid insurance, this is illegal as a basically agreement among the competitors. Or if the market allocations, when the competitors agree not to compete with one another in a specific market areas, basically, for example, they're trying to monopolize the market in terms of the producing a lower level of production and with the higher prices. These are basically illegal in the United States based on the antitrust laws. Let's start with the horizontal merger. Horizontal merger refers to the two or more firms in the same industry combined together. For example, two hospitals, they decide to basically combine together. So their physicians, they can work in both hospitals. So their nurses and their machines, sometimes they have the same technology. They decide actually to use it in both hospitals. So they basically merge together. There are possibilities they may actually harm consumers because it's easier for the remaining firms in the market to collude basically, so they can set the prices higher and the quantity lower in the market in their combined industry. But there is a possibility also to benefit the consumers if there is a possibility of economies of scales by better access to the technological innovations, right? Because both together they have a higher level of capital. They can actually afford better technological innovations to basically provide for the customers, or maybe there is a possibility of cost or resource saving that produce more output from a given amount of input, means that the same level of personnel or hospital bed or hospital room, they can actually service more number of the patients. So graphically, let's look at the Williamson merger trade-off, horizontal merger. We are looking at the cost-benefit analysis in the market for hospital services. In the horizontal axis, we have the quantity of the hospital services, for example, number of the basically days in the hospital for patients, or how many patients they can actually serve and give service in the hospital per day or per year. So you have to determine the time. And then you have the price per unit of the service. Is this per unit of service maybe the price per unit per day in the hospital per patient? So initially, suppose that there is a constant cost industry. We assume that the supply curve is not sloping upward, is basically constant horizontally. It doesn't hurt the conclusion from our example here. So the average cost is equal to the supply curve, is horizontally fixed at this point, is not upward sloping, but the market demand is downward sloping. The intersection of the market demand and market supply basically determines the level of output and price P0 and Q0. So in that case, initially, without merging, the consumer surplus is any point, any area below the demand curve and above the market price, which is this triangle of WDP0. Suppose that two large hospitals merge horizontally, then they decide basically to produce at Q1 instead of Q0, because that's how it works basically. When they have a power, they set their level of production lower at Q1. In that case, they go and intersect with the demand curve and set their price at P1 and Q1. So in that case, if there is a possibility that there is a possibility that there is a cost saving in the market. For example, if the average cost decrease from AC0 to AC1, in that case, there is a deadweight loss of this triangle of the triangle C. But if the average cost decrease from AC0 to AC1, then there is a possibility of the net gain to the the benefit to the society of rectangular B, which is P0AKH, or area blue rectangular of B. Now, the net gain to the society depends on this, the comparison between the net losses to society with this deadweight loss of C, ABD, and the gain to the society by decreasing the cost of area B. So to determine if the merger provides net social benefits, compare the deadweight loss of C and cost savings of B as average cost falls from AC0 to AC1. So these two area of B and C determines if the society is a winner or loser. Now, depends on how basically elastics are they basically say that the market demand, and also whether the decrease in the average cost decrease from AC0 to AC1 or lower or higher. So that depends on the basically decrease in the cost saving in the market, and basically depends on the so we can actually determine whether the net society is winner or loser from this horizontal merger. So in the case of vertical, basically merging. There are exclusive, say that exclusive dealing contract when there is a vertical restrictions. We have anti-competitive and pro-competitive impacts here. The vertical restrictions between manufacturers and distributors, alternative to a vertical merger. So we have the firm at different stages of production merge their operation. For example, in the hospitals, they have their own laboratory and basically different tests. They have the anesthesiologists basically, and they can have anti-competitive or pro-competitive impacts. So can potentially harm the consumers if the rival manufacturers are foreclosed, or can reduce the free riders problem. So what is the problem with the reducing free riders? In the market, for example, if there is a new product in the market and one of the rivals is making investment, for example, to advertise for the product and inform the customers about that specific product. And one of the rivals is making that advertisement and informing the customers. And if the other rivals actually to take advantage of that and get the customers of the other person who made that investment, this is actually free rider. But if they actually collude vertically, so there is a basically reduce in the free riders problem by this investment in informing the customers about the real function of the product that basically benefits the customers from the real impact of that product. So in the United States, we have also public enterprise in the healthcare system. Government may directly produce and basically distribute specific healthcare services in the county and city hospital services, like nursing homes and mental health facilities. They're all basically non-profit, basically governmental specific services. For example, veterans, administrative and military hospitals, they're all basically employed by the government. So it's like a UK basically healthcare system. The veteran administration is a good example of the UK healthcare system basically. In that case, there is no profit incentive, there is no cost minimization, and basically there are good things about equal access for everybody, but there is no incentive for minimizing the cost, and basically no incentive for profit maximizing, maybe no incentive for improving the efficiency even. So there is a redistribution function of the government in terms of basically income. So basically redistribution of income means that taxing one group and subsidizing another with tax revenue earned. So basically we are trying to set the utility to both recipient and donor groups up to the point where the marginal benefit of each of this group of recipient and donor group equal to marginal cost. Remember that we have a diminishing marginal utility. So we try to say that donor by donating their money basically and recipient by receiving the money, they can actually have maximize that in total the society's marginal benefit and marginal cost by these redistributions because of diminishing marginal utility of income. Now, equitable redistribution scheme says that there is a vertical equity and there is a horizontal equity. The vertical equity, we say that sufficiently progressive net tax system, basically we have a higher income people with higher income pay more taxes as a fraction of their income, right? So that's called progressive net tax system. And in the horizontal equity, we say that individual with the same income pay the same amount of net taxes, basically. In different services and businesses, basically, we have different types of vertical and horizontal equity. For example, when you have in your paycheck, if you look at it, the Medicare is a proportional tax, fixed percentage from each paycheck actually is deducted. That's kind of, so it's basically a horizontal equity. But in some cases, we have actually vertical equity. For example, so when we have the progressive is when the net taxes as a fraction of the income increases with income, such as federal income tax system, which is basically is progressive, and in the proportional when the net taxes as a fraction of income remains constant with respect to income, such as Medicare taxes, and the regressive taxes is when the net taxes as a fraction of the income falls with income, such as sales taxes in the United States, means that, for example, think about the consumption as a fraction of income. Most of the poor people, the consumption of the, for example, grocery accounts for their, say that 20% of their income, while for the poor people, for the rich people, it doesn't actually account for even 1% of their income. So that is called regressive. Or healthcare is regressive since lowest income families spend 23% of their total income in the healthcare versus the wealthiest spend on average 15% of their income in healthcare. So then also the low physicians reimbursement rate may create access problem for the Medicaid in recipient. For example, that's the example in your book about the physicians reimbursement rate, which is basically based on the regressive schemes here. The physicians reimbursement is much basically different in different states. Because, for example, the same reimbursement in Alabama is not the same as in Massachusetts, basically. So that actually creates an inequality in different states. Now, when the government is trying to use this redistribution of income, there are two ways to subsidize the basically people. One is from the supply side subsidy, and the other way is the demand side subsidy. Let's start with the supply side subsidy. The supply side subsidy refers to the grant of money to healthcare providers. So, for example, trying to expand the production of good by decreasing the marginal private cost of production. So because we have a downward sloping demand curve, and remember that we basically either upward sloping supply curve or we have a constant basically cost of production, this creates misallocation of resources because it gives basically a false signal to the production that the production is cheaper than the real actually price. So it's an inequitable way of redistributing income, and rich and poor alike basically end up paying the same price. This could be, the best example would be the government funding of medical school that basically in the supply side subsidy. So the basically the most negative impact is distorting the market price, which is giving the false signals about the price of the product or services. The demand side of the subsidy is the subsidies to needy individual. This is very basically more direct because people basically must qualify by passing a means test. So they have to basically prove that they really need. So that could be in two types of subsidy, in kind or cash subsidy. The in kind subsidy provides needy individual with specific goods and basically maybe services basically, but the cash subsidies is increases demand for various types of goods based on the basically people's preferences, so they can actually buy whatever spend in whatever they really think that they want. So this is funded by taxes, and the best example would be the Medicare and Medicaid. The Medicaid is a good example of the basically in-kind subsidies, and there are sometimes cash subsidies for both cases of Medicare and Medicaid, and also those dually eligible for basically Medicare. The taxation, basically, there is a welfare loss by taxation because we are distorting the market by basically changing the prices, right? So there is a welfare loss by redistribution. Remember, by any change in the market, you're basically creating a welfare loss by changing the price and quantity. Redistribution involves taxation. Some people basically must be taxed to finance the other people, basically, and tax on a resource involve a production deadweight loss. That should be actually here. So tax on resource involve a production deadweight loss, and the size of the deadweight loss depends on the tax, and depends on basically the burden on the suppliers and demanders, buyers and sellers, depends on the elasticity of demand and supply. So excess burden of the tax, net benefit that is lost because of the tax, depends on the elasticity of supply and demand with respect to the wage rate. So let's look at the impact of income tax on labor market. Now, in the labor market, just think about that. You are supplying your labor. So in the horizontal axis, we have the labor hours, your number of the hours you are supplying. And the price of your product, which is labor, is the wage. So that's the wage, which is the price of your labor, right? So you're supplying your service, so labor hours, say per day or per week or per year, and this is the wage, basically the price of your supply, your service. Now, so before the tax, laborers basically devote L0 hours of production and receive labor surplus of the area of the WAE at an hourly wage of W. So at this point, so basically you produce at L0 and then your wage is W, right? Now, suppose that there is a tax here. After the tax, the wage falls to 1 minus TW. The workers commit only L1 hours of production. So if there is a tax in the market, with the amount of T, so your wage is going to be 1 minus TW, right? So you, with the higher taxes, you're going to decrease your labor because you actually get lower for the amount of work that you were basically doing before. So the labor here is basically the incentive for working decrease, and in the total market, basically the labor hours decrease by the amount of imposing the amount of tax. So there is a basically labor surplus. Remember, any surplus in the market is for the suppliers. is the amount above the supply, below the market price, and for the basically buyers is below the demand and above the market price. Before the tax, the market price was W, so the supplier's surplus was this triangle above the supply curve and below the price was this big triangle of WAE before the tax. But by imposing the tax, the producer's surplus decreased basically by this imposition tax. Then the labor surplus falls to the area of 1 minus TW DE. That's all the surplus basically the suppliers of the labor gets. So the amount of WBD 1 minus TW is the tax, the basically redistributed to the other people, but this is basically is not missing, but we have a triangle of BAD, which is welfare loss that nobody is gaining in the market, and we are losing this point. So basically, this is dead weight loss of BAD, and the amount of WBD 1 minus TW redistributed in the market. So the excess burden is the area of BAD, which is the society is losing. So if we wanted to look at the impact of Affordable Care Act, basically, in terms of different subsidies, the good example would be the basically public health services that the Affordable Care Act is focusing on the intervention, especially for the low-income people, for example, which basically is more cost-effective by treating them at a prevention level than when they are actually more sick in the treatment. So $15 billion over 10 years, basically prevention for the sick people. The other actually subsidies could be we can talk about the community health centers that they are treating the patient with the very multiple chronic conditions. Again, it's very cost effective. So the Affordable Care Act initiated a few taxes on healthcare reform, basically, for example, on those services. They are they have high elastic compared to the basic. Those are with low elastic. For example, the tax on first of the medical devices on, for example, say that indoor tanning services taxes can be used on the patients. They have actually they didn't have insurance previously on treating those patients with the low income, and also additional Medicare tax on high wage workers, basically. So there are a lot of actually redistribution of the taxes from the high income to the low income in the healthcare system, using the elasticity of basically services, makes the market actually more cost effective in the healthcare system. Looking at the objectives of the chapter 9, hopefully we covered actually the role of government, we covered the implications of different types of public sectors, and we talked about the different methods of the redistribution, and briefly about the Affordable Care Act and government economic role, So basically, the market failure is a necessary but not a sufficient condition for government intervention. Why? Because sometimes the intervention can actually harm the consumers and producers more than benefiting them. So providing public good, correcting externalities, redistributing income, and regulating the marketplace. So we need enough information to basically have a net gain in the market by government involvement. Although market may fail and impose costs on society, the cost of government intervention sometimes may be much greater. So also both markets and governments fail in certain circumstances. So basically, one objective of economics is to determine which institution can provide which particular services in the most efficient and equitable manner. So let's see if we had enough in this lecture. What is the role of government when external benefit or cost occurs? So it's a multiple choice basic question. Is the role of government is the government should not become involved in the market and should leave it up to the market participant to settle any issues. Basically, lets the Adam Smith invisible hand take care of the market. Or the government should provide subsidies to those with low income in case of external costs, or the government should require basically procedures to impose external costs to reduce their output and to increase basically their output in case of external benefits, or the government should basically calculate the magnitude of the external costs or benefits and use subsidies and taxes to achieve the right rate of output in the affected industry. So definitely the governments basically should calculate these costs and benefit of the getting involved in basically affecting the market and then decide basically. So I'm going to give you a few example of the current practice basically. If you use the basically the we call that SAHIE interactive data tool to compare the number of the insured and uninsured in Maryland or any other states by counties during the year of 2006 to 2013, you can actually look at the basically number of the insured and uninsured in each state and look at the change in the number of the insured over the time after the Affordable Care Act. The United States Census Bureau, a small area health insurance estimates interactive data tool gives you this comparison by going to this basically data set. You can choose the data you wanted to basically choose by the number of the if you go to the left, you can choose the state here. Suppose that I'm choosing here the Maryland, and then you can also look at the counties and compare two counties. For example, I'm going to choose the Montgomery versus the Howard County, and then I actually look at the table. I can compare. I can look at the trends and see. Definitely, you can see the decrease in the number of the uninsured from 2006 to 2015, and definitely, basically, you can see the a specific, very actually decrease, high number of the decrease at the point of 2013. So the number of the uninsured decreased. So why do we compare these two countries? This is actually talking about the redistributions, means that, if you wanted to decide what area requires actually more basically subsidies from the government and less subsidies. So these are the way basically economists and the politicians and basically the data scientists are working in the government to decide which basically groups they need help to basically get the government subsidies. So this is one way to decide. So you can also look at the population without health insurance coverage. And basically nationally you can compare and you can see basically what states actually they need more financial aid or in terms of cash or basically subsidy in terms of redistribution in taxes. And this is the Montgomery basis, basically Howard counties I selected. You can choose different states or different counties. And in terms of another example I wanted to show you, in the University of Maryland School of Public Health, there is a Center for Health Equity work. Under the Dr. Stephen Thomas is running this center, and so they are actually working on the health in all policies framework. So they try to find basically different organization in the government, what they are doing for the poor people in society, and they actually set up different workshops. The policymakers from different organizations, they meet and they actually come up with the similar work they are doing, and they may actually come up with the a new decision they can make to make their actually works more productive by collaboration with each other. So actually I chose this policy in action to show you that what is going on in the recently in the University of Maryland. They're working on basically the healthcare system specifically. So the University of Maryland Public Health Center for Health Equity workshop is, these are the list of the impact of following factors on the health of residents of the states. They are trying to access to the safe and affordable housing, educational attainment, opportunity for employment, economic stability and inclusion of diversity, equity in the workplace, and barriers to careers, and then access to transportation and mobility and social justice, environmental factors, and so the people from the government, from different sections, they meet and they come up with the factors basically they may affect the people's life, and they come up with the solution. These are actually the activities at the University of Maryland going on. So they call that SB 340 meeting. I attended to October 26 meeting, and basically they received different policy inventories from Department of Environment, Department of Labor, Licensing, Regulation, the Maryland Academy of Nutrition and Diabetes, and so on. And then basically they're trying to figure out the impact of their work at this current time on the people's basically life. So basically the determinant of health and how they can actually impact people's life. Of course, this is kind of type of the government involvement again in the society, specifically in the healthcare system. This is the end of the chapter 9.